Hello guys, welcome back to this channel. I am Anuj welcoming you all. Today we are going to see about hydrocephalus. Let's start. Hydrocephalus is the buildup of the fluid in the cavities deep within the brain. The excess fluid increases the size of the ventricles and puts pressure on the brain. This is the picture showing hydrocephalic child. Meaning of hydrocephalus. Term derived from two Greek words. Number 1, hydro, which means water. Number 2, cephalus, which means head. This condition is sometimes known as water in the brain. Definition of hydrocephalus. Hydrocephalus is a condition caused by an imbalance in the production and absorption of CSF in the ventricular system. When production exceeds absorption, CSF accumulates usually under pressure, producing dilation of the ventricles. Incidence of hydrocephalus. Incidence of primary hydrocephalus without spina bifida is approximately 1 in 2500 live births, making it one of the most common developmental disabilities, more common than Down syndrome or deafness. It is the leading cause of brain surgery for children. Causes of hydrocephalus. There are two causes. Number 1 is congenital hydrocephalus. Number 2 is acquired hydrocephalus. Let's see one by one. Number 1, congenital hydrocephalus, in which intrauterine infections like rubella, cytomegalovirus, toxoplasmosis. Next one is trauma, such as subarachnoid intracranial intraventricular hemorrhages, congenital malformations like Dandy-Walker syndrome, aqueduct stenosis, Arnold-Chiari syndrome. Now, number 2, acquired hydrocephalus, such as tuberculosis, chronic and pyogenic meningitis, post-intraventricular hemorrhage, posterior fossa tumors like medulloblastoma, astrocytoma, ependymoma, arteriovenous malformation, intracranial hemorrhage, and ruptured aneurysm. Ventricles of the brain. This is a flow chart showing the ventricles of the brain through which the CSF flows, like from lateral ventricles to interventricular foramina to third ventricle to cerebral aqueduct to the fourth ventricle. Pathophysiology of CSF production and flow. CSF is secreted at the choroid plexus within the ventricles by ultrafiltration and active secretion. From lateral ventricles, it passes to third ventricle through foramen of Monro. From third, it passes to the fourth ventricle through aqueduct of Salvius. From fourth ventricle via lateral foramina of Lashka and foramina of Megendi, through which it passes to cistern magna, and then it passes to the cerebral and cerebellar subarachnoid spaces. This is the picture showing the non-hydrocephalic brain and the hydrocephalic brain. Types of hydrocephalus and their pathophysiology. There are two types. Number 1 is non-communicating, also known as intraventricular or obstructive hydrocephalus. Number 2 is communicating or extraventricular hydrocephalus. Let's see them one by one. Number 1, non-communicating or intraventricular or obstructive hydrocephalus. In this, there is blockage between the ventricular and subarachnoid systems, resulting in an interference with circulation of CSF and lack of access to the subarachnoid spaces. In this fluid, distends the ventricles. There is a gradual thinning of the brain substance which is compressed between the distended ventricles and the expanding skull. Non-communicating hydrocephalus may be due to stenosis of the aqueduct of Salvius, either a congenital defect or acquired. Obstructive hydrocephalus may result postnatally from brain tumors that put pressure on or extend into the ventricles or circulation pathways. Number 2 is communicating or extraventricular hydrocephalus. In this, there is normal communication between the ventricles and the spinal subarachnoid space. There is an interference between the absorption of CSF caused by occlusion of the subarachnoid system about the brain. The fluid that is not absorbed in the subarachnoid space accumulates, compressing the brain and distending the cranial cavity. Clinical manifestation in infants and in childhood. In infants, the head grows at abnormal rate. Anterior fontanelle is tensed, often bulging and non-pulsatile. Scalp veins are dilated and markedly so when infant cries. There are two main signs. That is number 1, McQueen sign, and number 2 is setting sun sign. In McQueen signs, with increase in intracranial volume, the bones of the skull become thin and the sutures become palpably separated to produce the cracked pod sound on the percussion of the skull. In setting sun sign, eyes rotated downwards, in which sclera may be visible above iris. The baby feeds poorly, pupils are sluggish with unequal response to light, changes in level of consciousness. In childhood, headache often awakening with improvement following emesis or upright posture, papilledema, strabismus, irritable and lethargic, apathetic, confused and often incoherent, bulging occiput, nystagmus, ataxia and cranial nerve palsies. That's all for today's video. I feel you all find it helpful. We will see you in next video. Thank you.